Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. You've got a blue cannula coming in the front of your shoulder. The camera's coming in from the back. And so right away we can see the rotator cuff tear, so we'll go ahead and get ready to fix that. The first thing we want to evaluate inside the joint is this biceps tendon. So I'll take a crochet hook.
A crochet hook?
Yep. And we'll use this as a probe. And as we tug down on the biceps, we'll be able to see if any of this tearing is the biceps tendon or if it's all rotator cuff. So far so good. That biceps tendon looks pretty good, doesn't it? And as you look at the biceps anchor, a little bit of fraying, but that's normal wear and tear changes. That looks pretty good. So I'm going to put the shaver inside here. Here you go. We'll show you some more in just a minute. Okay, we're just using our shaver to start to clean up the rotator cuff tear from the articular side. You can see the markings on the shaver give us an idea of the length, and so it's at least going to be about a 2 centimeter, maybe even more, maybe even a 3 centimeter tear, just as an initial kind of ballpark estimate based on what we're seeing here. So all of that kind of reddish area that you see, that's exposed rotator cuff footprint. That shouldn't be visible. And the reason we can see it is because the rotator cuff's pulled away from the bone there, right where my shaver is. Okay, so that's enough cleaning up on the tear. Let's take one good look inside the joint again. And as we rotate and look down, the rest of the joint actually looks pretty good, doesn't it? This is the back of the joint. The capsule here looks good. The articular cartilage on the humeral head up above looks good. The glenoid, which is down below, also looks good. Ligaments down the front of the shoulder, I don't see any significant problems there. So we are going to go ahead and finish inside the joint. We're going to get to work on that rotator cuff tear, so you'll get a different angle, a different view of it in just a minute here. Okay, so we're showing you, here, grab this, pull that cord up. We're showing you the tear here. Here it is. We know we're all the way to the front because there's a little glimpse of the biceps tendon right there. So that's all the way to the front of the tear. And then as we look back here, we're getting a pretty good look at the posterior extent of the tear too. Hold the camera just for a minute. I'm going to put the shaver in the front, and we'll have a look from the front to the back here. Yeah, perfect. So now we can see there's the articular margin. We're going to put an anchor here. It almost certainly is going to be 2, but we'll go one at a time. We're going to start with an anchor back right here. We'll take a spinal needle just to show you that. Okay, pause. Okay, so here's our first anchor in. It's got 3 sutures on. I'm pulling on it. It's very strong. We're going to go ahead and take a crochet hook next. And we're going to use a straight crescent suture hook first. We'll show you what all that means in a minute. Crochet hook. Crochet hook. And then we use a straight crescent and a grasper. So we take this blue and white striped suture first. Just like that. We take a grasper in the front. So the grasper is going to come through that blue cannula on the right. And we're going to take a special type of instrument that allows us to pass a wire. We'll take the straight crescent suture hook here. Next we'll use a turn to the right. So here's the suture hook. Let me just show you how this works. It's loaded with a black wire called a super shuttle. See it coming out of the tip there. Okay, you're on the scope with your right hand. I'm going to take that. And now getting these sutures where we want them is the next job. So we can see there, I'm going to hold this down like that. And there's a pretty good shot all the way underneath. We'll go ahead and feed that wire. And then once I retrieve that wire, we're going to load that blue and white suture into the wire. Here you go. Go ahead and do that. We'll give you one good view of this one. We do the same thing for each of the sutures. Keep holding. So as we pull back, see how it brings that with it. And now when we pull tight on it, that's going to bring that blue and white suture underneath. That's great. And so now we'll take the crochet hook and get the partner suture. And this is why they're color coded. If they were all the same color, it'd be really hard to tell, right? And so now we've got this one here, and we can tie our first knot right there. Okay, so we've tied the first knot. You can see it right there. There's the suture, and that's holding down that part of the cuff. That looks great. We're going to go ahead and pass another stitch right about here at the tip of that blue cannula. It's probably going to be just a 1 anchor repair the way it's looking. Hold that, please. We're good. Just grasp her and a turn to the right. Mm-hmm. So here's our next suture. See how it's got a little bit more of a bend to it. This is what we call a 60-degree curve. And we're just going to kind of split the difference between the remaining tear. So if I want to place this right about here, there you can see it coming through. And I'm just making sure it's all the way underneath, and that looks good. There's the relay. Okay, pause. Okay, so now as we pull back, see how that brings that second stitch up. This is a solid blue one. We'll pull tight on it just like that. I'm not going to tie this one right now because it would make it too hard to see the third stitch. But I am going to retrieve it just like that. Okay, and now, hold the camera there. We'll go ahead and take those out of the way. And now we'll get that final suture that we want, which is going to be this black and white striped one. Just like that. And so now we'll take our turn to the left hook. And this last stitch is going to come right over the biceps tendon. The biceps tendon is that kind of shiny rope-looking thing right there. We're going to place a stitch that covers that up. Okay, so we've tied all three sutures. You can see them almost looks like a little claw there. The blue and white one's off to the left, the solid blue one's in the middle, and the black and white one is off to the right, which is anterior. And you can see, well, you can't see the biceps anymore. So we've got that all covered up. And as I rotate your shoulder, that looks like a very solid repair. I'm very happy with that, okay? So the last thing we're going to do to try and stimulate a little bit of healing here is take our punch, which is just a 2mm punch, and we'll make some little holes in the bone to release some of the bone marrow here. So we're going to look up here. We may. Now I'll tell you what. Get me another anchor. I do want to put in one more anchor right there. There's a little bit more anterior, so we'll go ahead and get that done, and then we'll show you some more. Okay, so now we're really done. We added 2 more sutures. We've got 5 now. There's 1, hard to see in the back. 1, blue is number 2, that's number 3, there's number 4, there's number 5. And now we've got that fully secured all the way up to the rotator interval. And so I'm happy with that. We're going to finish up here and get you back to the recovery room shortly, okay? So good luck to you now. Bye-bye.